This is a challenge that came to me about 3 weeks ago, and the idea here is to give a global and well-deserved tribute to the frontline workers who've carried us through, this pandemic. So, interestingly, it came to me as I was literally working out in the morning, and I came up with the idea that we could do this kind of a fundraise, sort of like a variant of the Ice Bucket Challenge from years ago. And I first talked to Mount Sinai about just doing it for Mount Sinai. And as we talked about it further, we said, this will be more interesting if we could be national. And then I scared the people at Mount Sinai because they said, how could we possibly do this? And then we came up with the path. So it's been a while to put this together. But what we have 26 academic medical centers in the United States, among the leading in the world. And these are a treasure to the United States to have these academic medical centers. And their employees of the hospitals have really been treasures to us to take care of us during this period. So the idea is for someone to be able to sort of pick an activity, run 5 miles, bike 25 miles. I'm going to shoot baskets, and then get people to sponsor you. And the proceeds of which go to the hospital of your choice. So we have 26 that are in, but this is an invite to any hospital system, any academic medical center that's out there to join this challenge and raise money truly in honor of the front line. And I have a personal reason for it because my son is a frontline worker, and he was there in the middle of the surge. And he's now back. He finished his 4th-year residency. But this has been a passion for me to take care of our front lines from the beginning of the pandemic.
Oh, and it's a great idea, Rich. And Ben, you guys at Pinterest are corporate sort of partners, I guess, for this and supporting the push. And you also yourself have developed an app that's here to help us through this crisis. Is that right?
Yeah, when Rich shared the idea, I was really excited about a chance to say thanks and also raise money for the folks that have been working so hard to keep us all safe. Both of my sisters, both my parents are doctors, so I definitely, like Rich, feel personally connected to it. And then Pinterest, the platform, is all about inspiration, and we have a lot of creative folks on Pinterest that would love a way to contribute in some small way. So we were excited to jump on board. As you mentioned, separate from Pinterest, we've also been building an app to help fight with the epidemic. It's called How We Feel, and it's an app that lets people share their symptoms as well as their emotional well-being. And we provide that data to researchers to help them better understand the spread of the virus and how we can best support those in need.
Rich, wanted to ask you about the Mount Sinai Health System and how the hospital is doing now that the case numbers and hospitalizations have gone down in New York, but it's still very much a hot spot. Just give us an update on what the hospital looks like, how much normal activity has resumed, and how much is still dedicated to COVID-19.
Well, Sarah, that's a good question. The way I look at it is there are 3 phases to what's gone on. The first phase was the surge, and I'm happy to report that the surge is really over. That no more than 20% of our hospitals basically have COVID patients, and the other 80% has been cleaned and sanitized and is essentially reopened for mandatory or required kind of surgeries. We're still waiting for the governor to allow elective surgeries, but that's what comes next is for people to resume their normal health care, which is critical because if people basically stop and don't go in for their procedures that they need to, that's going to create a bigger issue. And to me, phase 3 is what comes next, and we don't know what comes next. So I think the good news is we're down to less than 20% of what we had at our peak. The hospitals are basically pretty quiet. There's really very few people in the emergency rooms. So, I would encourage anyone who is, needs to go in for surgeries or procedures that they do it soon because we don't know what's going to happen in the fall. We don't know what's going to happen, as we even go through the summer. So, and this is true, I think, of all the hospitals, certainly in the New York and New Jersey metropolitan region, as we are past the surge period, which is a great timing for the tribute that we're doing also for the frontliners right now. They're getting a reprieve.
Ben, wanted to ask about the sort of levels and type of engagement you've seen on Pinterest over the last couple of months. How have the overall levels held up? And have you seen what people are kind of engaging on change, particularly as it relates to sort of going out or staying in type topics?
Yeah, we've seen record levels of engagement on Pinterest. So more people are visiting every day, and the number of people that are saving ideas is at an all-time high. As a company, we look at 2 things. First, we want to make sure that people have access to really high-quality medical information from organizations that are trusted. And so that's been our first priority. But as you said, we've been able to also understand what people are looking for, and it's a lot of the stuff that you might expect. People are trying to reset their sort of living and work habits. So we see people searching for easy recipes, ideas for helping their kids out, ideas for staying fit while they're at home, for reorganizing their home since they're spending a lot of time there. We also see some people that are just looking for entertainment. This is a tough time for a lot of people emotionally. They may have lost their job or be dealing with loss. And so we see people coming to Pinterest as well for ideas on how to recenter themselves and get a little bit of escape and relief from the push of pretty intense news over the last few months.
But Ben, are you able to capitalize on that increased, potentially record engagement and users if advertisers are pulling back and feeling the recession?
Yeah, well, we first want to serve users, as you mentioned. And then when it comes to advertisers, there's a mix. There are some advertisers that are really showing signs of optimism in their spending. And there are others, many of whom have all of their stores closed, that are wait and see mode. And with those advertisers, we're really trying to go to them and support them through this period. We know that it's a long game.